Hello and welcome to the third episode of the Guildwood Review. I'm Rashid Chaudhary. I'm a historian and an independent scholar, and I'm coming to you tonight from Guildwood, which is in Toronto, which is in Ontario, which is in Canada. This is a podcast of ideas where we interview experts in various fields who tell us about the work that they are passionate about. And tonight it is my privilege to be joined by my friend Dr. Kashif Pirzada, who is an emergency room physician here in Toronto and is also affiliated with three different local universities, namely the University of Toronto, Toronto Metropolitan University, and McMaster University in Hamilton, Ontario, in the latter two of which he serves in the capacity of assistant clinical professor. And he's also, if that weren't enough, the co-chair of the Canadian COVID Society. Kashif is going to be telling us about the lingering after effects of the COVID-19 pandemic, as well as concerns about public health in general. I was about to say I hope you enjoy this episode, but perhaps enjoy isn't quite the most correct verb to use, given the seriousness of the subject matter. And so what I will say is that I hope that this episode is going to be informative. Assalamu alaikum. Welcome, Kashif, to the Guildwood Review. Thank you so much for joining us. Why don't we actually begin with a story that appeared on the BBC today, as it happens, and that I think you've had a chance to have a look at as well. It was an article by David Cox called "The Mystery of Why COVID-19 Seems to Be Becoming Milder." Just to kind of summarize the findings, the three perspectives that are shared in the article, there's Harm van Beckel of Mount Sinai in New York, who says that only approximately 10% of the cases of hospitalizations with respiratory illnesses these days, at least at his hospital, are due to COVID-19. And then there's Peter Ching Hong of UC San Francisco, who says that COVID-19 is, that's kind of where the headline of the article is driving at. So what Ching Hong says is that the illness is transitioning into a state where it's only going to be dangerous to people who are over 75. And for people who are younger than that, most will not experience any symptoms at all. And for the rest, it's turning into something akin to a mild cold. And then there's finally Mark Johnson of the University of Missouri, who's cited in the article as saying that COVID-19 actually is taking a completely different direction from the above discussion regarding respiratory symptoms, in that it's becoming a gastrointestinal illness. He says that the ancestor of the SARS-CoV-2 virus used to be a virus similar to gastroenteritis in bats, and then mutated into a respiratory illness in bats, became the same thing in human beings, and may once again become a mostly gastrointestinal virus in human beings as well. So I think quite a bit to unpack in this one article. I don't know if you are in your practice noticing any of these changes that the three researchers cited by Cox in this article have seen, and if so, to what extent?
So I think some of it is makes sense, but some of it I think is probably minimizing what's going on out there. Just to introduce your audience, I'm an emergency doctor that practices in the Toronto area. and did some work for COVID advocacy during the pandemic. Now, it's obviously not as impactful as it was up to 2022. People were not filling the ICUs like we used to. We are not, seeing crushes or disastrous surges in hospitals like we used to. But there is still a burden of illness that we see in periodic waves. We came off of one in North America in the summer, where there were a surge in hospitalizations, but we're not seeing quite the same impact as before. Now, what are the reasons for this? I think in the article that you mentioned, there is more widespread immunity than before. People are being exposed to the illness constantly. There's much more, almost everyone got their vaccinations, 3 years ago in 2021. So there's a lot of immunity from that. The unfortunate thing is that along the way, there are people who are far more affected than most. So you have people developing long-term COVID symptoms, but you don't know because you're not seeing it from the clinical side. Like I have to regularly set up referrals for family, friends, or colleagues who need lung specialists or heart specialists, and for all the kind of weird problems that develop after infection. And it's usually, for the most part, it's majority is women, usually late 30s and older, elderly people, and just unlucky people. The fittest person I know had an infection in September. This is a guy who goes winter camping and
Wow.
Runs marathons, Ironman type thing. Now he can barely go up the stairs in his house.
Yikes.
And I have trouble, finding a specialist for him. And he took his 3 shots, in 2021, nothing since then. I don't know what he has, honestly. We've tried medications, puffers, everything. And we're having trouble getting him to see a lung specialist. So it is not as impactful, but it is definitely there. If you look at mortality studies, you're seeing excess mortality across most age groups that persists even after the acute phase of the pandemic. So especially in younger age groups. So, there's an increase, people in their 30s and 40s should not be dying of really anything. And we're seeing increases in excess mortality in that age group. So there definitely is an impact. It's not the kind of impact that will, stop the functioning of society that we faced in 2020 and 2021. But there's an impact that is still there, unfortunately.
Right. And so when you say that there's a substantial amount of excess mortality in people in their 30s, your findings seem to be sort of the opposite of what Ching Hong is finding, where now it's supposedly only of concern to people over 75. So do you think that the issue is that a certain amount of mortality is something that society in the US at least finds it can live with and tolerate? So a higher level of mortality in younger people than before the pandemic, which is why it doesn't seem so severe? Or do you actually think that the severity of it is visibly becoming lower? I mean, you say that the danger persists, and I take your point. But to what extent is the persistent danger still getting decreased over time?
I do think that the long-term COVID risk is lower than it used to be. I think the most affected generation in that illness was the people who were infected in the first years when there was no vaccine. A lot of them have very profound disabilities and aren't recovering. A lot of people do get disabled. I've had people in my own family who've had long-term COVID symptoms who mostly recovered after about a year or more. I have family friends and friends who have relatives, and basically, usually it might take months, it might take years. Most people do recover, but some people don't. And the worst affected are the ones early on. So I think there is an improvement over time, but it's really hard to see. We don't really have good numbers for that. Regarding the young people being affected, I think you just have to look at the entertainers who are disabled. Where it happened, where is Justin Bieber? He was, famously affected by an illness that usually only affects elderly people. and it happened during one of our waves. So look at the hockey. There's a bunch of hockey athletes, performers, entertainers. All of them have had to end their careers early or have been on indefinite leave. So it's not mortality that's the only worry. It's disability, and it may not affect you at all. Like, I've never developed COVID. I've never been disabled by it, but maybe
You've
I
been
could develop an
fortunate.
infection and then get some disability from it. It happens. It's just the luck of the draw. We are being constantly maybe subclinically, like no symptoms being affected by it, but maybe you could develop one day. It could be your lucky day, and you could end up with persistent symptoms. You don't want to be in that lucky draw.
Right. Well, that brings me to one of the questions that I was going to ask you, which is what exactly is long COVID? Because these persistent symptoms that you talk about, or people, taking a year to recover, and sometimes the disease being sort of difficult to pinpoint, like once you're past the kind of infectious stage. Is all of that due to long COVID, and how long can it last, and what exactly is it, to the best of your knowledge? Given that, yes, you did say that it's hard to actually say what it is.
Well, you know what's interesting? So there's the Sandman show on Netflix, I think, a while ago by Neil Gaiman, and Neil Gaiman is, obviously being rightly disgraced for his behavior, but his show was about an epidemic of paralysis and sleeping sickness that happened in the 20s, right? That was a real event that happened after the flu pandemic in the late teens and early 20s in the last century, where people had this post-viral syndrome where they were profoundly disabled. And we see these post-viral syndromes all the time. Like, people get an infection and then suddenly they're just not the same. They're tired all the time. Their thoughts are fogged up in what they call brain fog. And you see it occasionally. No one really knows what to do with it. There's no real diagnostic test for it. There still isn't even now. But with the COVID pandemic, we had an event where millions of people got the same disease at the same time and developed post-viral symptoms at the same time. The causes are not completely clear. Maybe overactive immune system, maybe viral remnants are still in the body affecting things. But the symptoms seem to coalesce around a few symptoms, like brain fog, where a profound cloud sort of envelops all your thoughts, lowers your processing speed, diminishes your memory, profound fatigue, even doing basic things, household things. There's a subset that develops, chronic heart issues, myocarditis, pericarditis. These are complications of infection that we see fairly regularly, especially in young men. Respiratory issues, scarring of the lungs, that can happen as well. And in elderly people, we see an acceleration of cognitive decline. So dementia seems to get worse. Kidney function seems to get worse. And that's in that above 60, above 75 cohort that was mentioned in that article.
Now, you are the co-chair of the Canadian COVID Society, and according to the website of the organization that I've had a chance to look at, COVID is the third leading cause of death in Canada as we speak, after heart disease and cancer. Do you think, given attitudes towards health that you see kind of in society around you, versus the reality that you see in the hospital during your work, do you think that we as a society actually give COVID-19 the weight that it deserves as a danger, given its rank in what kills us? Or do you think that we're tired of it and would prefer not to see it and to move on?
Well, most definitely the latter, I think. I think we're all tired of it. It's just so that number, the third leading cause of death, was from 2022, but has been coming down since then. So it's probably still in the top 10. So the usual causes of death, stretching back decades, has been cancer, heart disease, trauma, accidents, respiratory diseases. COVID shot up to one or two in 2020, 2021, and has been steadily dropping. I think it's probably sixth or seventh in some places, depending on how you count the numbers. But if you look at its knock-on effects on increasing cardiac disease, we see much more heart attacks and strokes than before. There's some theories that could cause, cancers to accelerate as well. So I've seen that in my own family. So it could cause the other causes of death to increase as well. So, but that being said, even that it is a new disease that has made itself felt in our mortality tables, our attitude towards it now is profound fatigue. I don't really see any appetite from any, politician or health leader that really wants to address it. What's amazing is that, we're facing, the possibility of bird flu spreading, and we still don't have, an agreement to work on, things like basic things like ventilation even in hospitals, ventilation in classrooms, lowering the chances of any respiratory illness spreading. We can't even get people to agree to wear masks in acute care hospitals. So if your relative has cancer and has a weak immune system, they would sit right next to someone who's coughing their lungs out, and no one sees anything wrong with that. So
the reality regarding masking was very, very different even just 2 or 3 years ago. I mean, people would be hyper aware of somebody not wearing a mask. I mean, even on public transport, let alone a hospital. So has there been that much of a shift back to sort of how things used to be in the medical field, where, well, not so much in the field, but in terms of patients?
It's very interesting. And I think there's got to be some studies done on this. It depends, how affluent a neighborhood is, or what the percentage of immigrants in the neighborhood, and wearing masks. There's probably a sociologist or an anthropologist could spend a lifetime studying why, some hospitals I'll walk into and nobody's wearing one, and then other hospitals I'll go in and everyone's wearing one. So especially in the Toronto area where we have so many different cultures interacting with each other.
Sure. So from what I gather, then the purpose behind the Canadian COVID Society and sort of its main area of activity is advocacy, right? Sort of spreading awareness regarding the dangers of COVID and mitigation attempts, such as improved ventilation and so on. What sort of audiences do you try to reach, not as an individual, but as part of the COVID Society, when it comes to spreading this kind of message? Is it the public, as it were, or is it sort of decision makers? Or you say no one's listening, but whom would you like to listen to this?
So our three main objectives right now are to safer healthcare settings. So you or your relatives who go to hospital should not be unnecessarily exposed to COVID and other respiratory diseases when they go there. If my mom goes in for knee surgery, I don't want her to get COVID while she's there, or the flu, or whatever. There's enough technology, there's ventilation, there's filters that could prevent that entire outcome completely. The second objective is to ensure that our children can go to school safely in well-ventilated classrooms. There's a lot of research now that shows better ventilated classrooms mean, better school performance in general, reduced respiratory illnesses in a dramatic fashion, 70% reductions in respiratory illnesses. So think of all the scholarly time lost, think of all the parent time lost in terms of missed work and all that. So that's our second goal. The third goal is helping, survivors, people with long COVID, who are dealing with a health system that's still, even 5 years on, not very responsive to their needs. So when our target audiences generally are regulatory bodies that regulate healthcare settings, school boards, the politicians that overlap on those areas, the public as well, to raise awareness of these issues. Your kid does not need to get sick every few weeks from school. That's not, having them get sick over and over again does not make them stronger. That's a common misperception that people have. Your immune system does not get stronger the sicker you get. It just doesn't happen. It's not a muscle to get stronger. It's more like your hairline. You lose it over time. So
that's a very important point to make.
So that's an important thing. Your immune system is a resource that you can deplete, and infecting it and hitting it harder, especially at younger ages, predisposes you to worse outcomes in the future. And there was actually an interesting paper that came out on that recently, and it's been verified over and over again. So those are our three objectives, and our target audiences are politicians, media, and the public, to try to further those three goals.
Right. And from what I gather, it's been a bit of a struggle, since the death counts have gone down, right? People don't want to hear it anymore.
Definitely. It's become radioactive, unfortunately. And I think our goal is like, no respiratory illness should disable society like it did before, like it did in
No.
2020. Pandemics will happen again in the future. There might be some, God forbid, some recombination of COVID in the future that will come roaring back. Bird flu starts spreading person to person. The Russians decide to release their smallpox stockpile. God help us.
Oh God.
Who knows? Anyways, we have the tools now. We learned the lessons already to make sure that kind of stuff can be nipped in the bud. That means surveillance. We developed wastewater surveillance technology to a great extent during the active phase of the pandemic. Preventative stuff. So let's say a bug starts spreading, we should be able to tell the population, okay, guys, wear a mask in crowded settings, without that being a political problem. Bird flu starts spreading in let's say in Alberta or Ontario or Kansas or whatever. We should be able to say something as bad is happening. We need to be preventative for the next few weeks to make sure it doesn't shut us down again. That's the kind of proactiveness we want to look at. We want to make sure that the workplace you go into should be well ventilated. A lot of them are upgrading because we were able to, or other activists were able to lobby the main HVAC society to create a standard for better indoor ventilation. That's the ASHRAE standard 241. So that's happening behind the scenes, but that's the kind of work that really makes a difference over time.
And how far are we, do you think, from actually being prepared, for the new pandemic that's inevitably going to come at some point? We just don't know when, right?
I don't think we're going to be well prepared at all, really. We have unfortunately politicized a large amount of the response that really worked. Like if you look at the way Canada addressed the pandemic versus our closest friends and allies in the US, we had 1/3 to 1/2 of the death count that they did. We saved a lot of lives here by being more science oriented and much more careful. And it still divides our politics. It probably drove a lot of the polarization that's happening now, and that really shouldn't have happened. And whatever future preparations have to address that polarization against science-based measures, against preventative things that really saved a lot of lives.
So one of the primary causes of the polarization that you describe, I would say, was first of all the vaccine, because you had the anti-vaxxer crowd, who were doubting the effectiveness of the vaccine. Partly because it was created so quickly, whereas normally vaccine development takes a long time, so which drove skepticism for a lot of people. Now, given that the acute phase of the pandemic, at least, is over, and that I'm sure studies have been done since, which were not possible immediately. What do we know now about the extent to which the different vaccines against COVID-19 are actually effective?
What's interesting, it's like the vaccine was the greatest accomplishment of the Trump administration. It's something he dares not take credit for. They created a whole operation, Warp Speed, that
Sure.
it was a miracle. Like I remember how much we fought to get the first doses. Like I remember, like in the hospitals, like it was like me, take me, because we were so scared. Like we saw so many people going down at that time that we all wanted that protection, and then people were fighting over when to get it in that first rollout. And what a difference a few years have made. So I think the studies have been pretty clear that tens of millions of lives were likely saved by the vaccine. One of the vaccines withdrawn, which was the AstraZeneca Oxford vaccine, based on the clotting issues that developed. And we've gotten, if people had concerns about mRNA vaccines, we have a decent alternative, which is the Novavax vaccine, which many studies are showing is actually superior to the mRNA vaccines.
Okay, so for those who are not aware of the difference, such as myself, like what, like in a nutshell, what is the main difference between the two?
So the mRNA vaccines were a relatively new technology, which gave your body kind of a blueprint to make a protein. It uses your body's machinery to make the protein. The Novavax is actually, they give you the protein.
Right.
and that's already pre-made and it's not synthesized by your body. And it has less side effects. I know every mRNA vaccine it knocked me out for about 1 or 2 days. So the Novavax ones, they don't do that at all. I have no side effects from that. So
Right.
we have a number of options now, and the study's been very clear since the onset of the vaccine program that it's safe and has saved tens of millions of lives.
Now, given that it has played such a large role in saving us from what might have been a lot worse without the vaccines, um, do you think the vaccine mandates, which were at least here in Canada, among other places, politically controversial, uh, to what extent do you think the vaccine mandates were necessary? And of course, there were various kinds, as you well know. I mean, there was the kind that required people to be vaccinated in order to undertake international travel, for example. There was the one that the truckers faced, and various kinds. Uh, for instance, we have Prime Minister Trudeau, who is in the process of handing over power to a future incoming Liberal government. And during this time, I've seen friends, who were politically supportive of the truckers, remembering those days now, given sort of the political events of today, and saying, if there's one thing that I'm never going to forgive Trudeau for, it is, his imposition of the mandates. To what extent was Trudeau right in actually imposing the mandates?
So the mandates federally really only covered the civil service, I think. Um, I'm not sure about the transborder stuff. I think what happened was initially the thought was that the vaccine was, the end to all illness. Like it would stop completely the whole disease. And as soon as evidence showed up, which happened in the summer of 2021, so the vaccine rollout, if you remember, was early, very late 2020, early 2021. Um, the thought was that would be the end of the pandemic. There would be no transmitting COVID. But then in the summer, there was some key events where you had transmission despite the vaccine. Then it became obvious that this thing wasn't really going to go anywhere, go away. That's when I think the mandates really should have probably been dropped. And I think with the spread of the Omicron variant, which was much more contagious than previous ones, that pretty much should have ended any thought of mandates. And I think if Trudeau made one mistake was to keep the mandates on the civil service long after the Omicron variant showed that the vaccine mandate wouldn't really help or stop anything. I think at the time when the idea was that it would stop all disease and we could go on with our lives, maybe there was some justification for it. Some scientists, who were proven correct over time, predicted that would not be the case, that it would keep mutating. But overall, considering the polarization that developed, I think we would have to really rethink mandates in the future. But that raises a lot of ethical problems in the future. So let's say bird flu starts spreading.
Right.
That has a 50% mortality rate for humans. The one variant that's spreading in birds. We run out of healthcare resources again. Do we treat people who refused to get vaccines? That's an important question. And that's the question we faced in 2021. It's like we had enormous masses of people coming for care at the same time. We filled all our ICU beds. One hospital I worked at, we transferred out hundreds of people to ICUs across the province because this is where a lot of essential businesses were clustered that were working in poorly ventilated settings and getting sick in huge numbers. Whole families were going down at the same time. And if one of those people refused to get the vaccination, what do you do? Like, how do you allocate those resources? So there was a lot of ethical problems at that time that people were considering. And it was very tough decisions to make in a lot of cases. But I think, extending mandates beyond when it became obvious that they weren't effective was the big mistake, I think.
Right. And so more broadly, you compared our approach here in Canada to that of the cousins to the south who some of whom would like to be our masters, I guess, but that's a whole separate topic. But looking at a wider range of countries, we had countries such as China where it all started, but also and sometimes people would say that the approach that they took was only possible in a controlled society with a kind of authoritarian form of government, because people had no choice about obeying the rules. But then you had a democratic society such as New Zealand that had, at least to my mind, a very similar sort of approach. And then you had an in-between kind of society with elements of both systems in Singapore, which also seem to take a similar kind of stance, of sort of really tightly restricting travel, and isolating all of society to the extent possible, and then having a very minimal number of deaths. I mean, actually, excess deaths in China were negative from like what I saw in the WHO report. So like, yeah, COVID saved lives in China by preventing people, I suppose, from driving and doing the other things that people do
Well,
or doing.
China was a very weird case because one their whole lockdown approach was crazy. Like they would weld people into their buildings, I think. And like, the Shanghai lockdown, which went on for I think 2 months, where people were running out of food, and it was incredibly like ham-fisted, like very blunt,
Mm.
considering what we learned and kind of what they told us in the early stages, that the disease was airborne. There are airborne precautions you can take to really prevent spread, like filters and masks and things like that. The other thing is they used relatively ineffective vaccines, like
Because they insisted on using Chinese-made ones, right, which weren't the best on the market.
exactly, and then they had very poor uptake in their oldest members of their population. So, and then when they finally relaxed, and they did it all of a sudden without any preparation,
Well,
they
there was
probably
there was
killed.
kind of they were facing political demands from the public though at that stage, and I think there was
And
little that could be
their
done.
approach was like, "You want freedom? Have all the
You're
freedom you
welcome
want."
to it. Yes,
and then,
but so
like 5 million people died by some estimates, right? So I know they don't
really.
release real data, but I think
Hmm.
if people extrapolated from the number of obituaries in academic departments or something, and spread it out, so
That's
they
that's a,
they
that's a very interesting approach. Yeah, but so yeah, more broadly then, so you had that sort of restrictive approach in the countries I named, including China. But then you had a kind of free for all, like with the U.S. in the early days of Trump, or with Britain under Boris Johnson, where they were aiming for herd immunity, without actually spelling it out um, in the beginning, and then kept delaying lockdowns by multiple weeks until people started dying in significant numbers. And then you had a kind of in between approach, here in Canada, where you've already said that the Canadian approach was a lot more effective than in terms of saving lives than the American one, or the Turkish approach, for example, where Turkey is divided into approximately 81 provinces, and for a long while, actually, travel between the provinces was restricted, and then there were 22 hours a day curfews imposed on the elderly and the very young, and so only people of working age, could go out, except in the evenings when there were curfews for everyone, and then on weekends there were curfews for everyone, and there's a few months worth of that. So not quite like in China, but not, go and have parties and infect people, like in London, like in Britain, because before Partygate, uh, I mean, Partygate became a scandal only because at 10 Downing Street they were still holding parties after lockdowns were imposed on the rest of society. But there was a good long while when everybody was living the Partygate lifestyle. And the disease was spreading freely, and people, there would be all these pictures that I was just wondering at, on the BBC website, of like a nice warm day in London and everybody gathering together and just enjoying themselves, kind of pretending that the problem wasn't there. So, uh, given what we know now about excess death rates and things like that, um, And then, of course, there are countries like Belarus, for example, where the government actually decided, for economic reasons, as President Lukashenko said at the time, not to impose any sorts of restrictions. He acknowledged that the pandemic was there, but he said our economy just cannot bear any kinds of closures or curfews or anything of the sort. But then you had places like Turkmenistan and North Korea that just by decree said, we don't have COVID-19. So there's this whole, plethora of approaches. Leaving aside the idea of democratic freedoms and things like that, which did seem at the time at least to be the most important consideration in some people's minds, but looking at it purely from a public health perspective, which do you think was the best and the most effective approach?
The island countries did the best, I think, at the
They
initial
couldn't
part.
help it, could they?
They couldn't help it. And then, the maritime provinces in Canada did a very good job, basically keeping it out, the entire disease out of their region for 2 years. So without, and they had normal life in that area. So they did great. I think over time, I don't think anyone got it perfectly well. I think in central parts of Canada, there was a good compromise. Like you had mostly a return to normal activity, but with people wearing masks in indoor spaces for a while until things calmed down. The problem was, and I think this is a continuing issue, is that people don't want to deal with the fact that a disease could be airborne. And what I mean by airborne is that it can persist in an indoor space and float around and infect people. And there is a long-running controversy with WHO and the bodies that regulate public health and infection control about what airborne means. And that they classified COVID-19 as not a airborne disease, but something that spreads by droplets. That if I'm coughing, you see the spittle that lands within 2 meters of you, so it's not going to be a big deal.
But aren't the droplets spread by air, which doesn't that make it airborne anyhow?
Yes, exactly. So you understand it, but trying to get people who make their professions out of this to understand it was very difficult, because what does that mean if something's airborne? That means you need to spend billions of dollars fixing the ventilation in all public spaces. And so all of these countries that locked down and welded people into their homes and did 22-hour curfews and all these crazy things didn't have to do any of that. We didn't have to close restaurants or anything like that. We could have just, maybe distanced things and had better ventilation in restaurants. It's a huge thing when you think about it, that we didn't proactively look at the way this thing was transmitted. We didn't take action, and we still haven't. So we could be hit again by another airborne disease and have to shut down again and incur trillions and trillions of dollars of economic cost, because we will not acknowledge, and no country acknowledged this properly, that it could spread by the air and we need to contain it in the air. So that if no country did it well, because no country recognized that.
Right. So, in the Borat movie, at the end of it, during the credits, there is a fake national anthem of Kazakhstan. One of the lines there goes, "Filtration system, a wonder to behold," right? So what kind of filtration system, would be a wonder to behold in our case, as in, like you mentioned, a certain standard that's being developed now. But if you take the best ventilation system and the best filtration system in the world and install it in everyday businesses such as restaurants, the kinds of places you mentioned, to what extent then do we actually protect ourselves from airborne particles, airborne droplets that can infect us?
Oh, I think they also had some other lines in there, they have the best potassium in Kazakhstan too, right?
Certainly, yes. But in our case, yeah. So, to what extent can filters actually?
So there is, actually, what's interesting. So the Manhattan Project in, the 40s, that developed the atomic bomb. They developed technology at that time called the HEPA filtration, high efficiency particle filtration, to isolate atomic particles that they used and to prevent, their staff from being irradiated. So it removes, HEPA filters are the ones that remove these particles that carry viruses on them, like respiratory particles that float in the air. So those can clear the air. So you just have to get the right size one. building them into your ventilation system is a good thing too. Like the other thing is getting more fresh air into your building. That's done by your engineers. I actually built a map where people can report, their indoor ventilation using CO2 monitors. So if you think of CO2 kind of like a backwash, like if you have high CO2 coming from people breathing, that means your ventilation system's not clearing it out. If you
That's a
have low
great point.
CO2, that means you're bringing more fresh air in to clear out to clean out that air. So the hospitals where I work, they were all built after the SARS-1 epidemic, 20 years ago in Ontario, which was, killed a few dozen people here, shut down all our hospitals. So I have
There was a
constantly,
travel warning regarding Toronto from the WHO at
yeah,
the time, right? Yeah.
the last ever travel warning ever issued against the city, because they were told not to do those again, which is a big problem now. But anyways, that's a long story. All of the hospitals where I work at, the level of the air quality is almost like breathing fresh outdoor air all the time in almost every room in every hospital. So
That's
that's the standard, and
incredible,
that's
actually.
incredible. Like I never caught it. I've
Yeah,
seen
thank God.
thousands of COVID patients, up
Yeah,
close, kids screaming in my face. I've never caught it from in the hospital.
amazing.
So that's what people should get in their workplaces. That colleague of yours who's coughing, across the hallway in your office, that shouldn't make you sick. And, that's how these things will be stopped. So none of these countries that planned all this, that did all these lockdowns, these crazy 22-hour things, or locking whole cities down, cutting off food supplies, all of that was crazy because it wasn't necessary. And it doesn't need to be necessary in the future, because you got two tools to stop in cold any disease that spreads, which is ventilation and temporary use of masking.
Okay. But the, regarding temporary use of masking, okay, you go to the store, you buy a mask, you put it on. But regarding ventilation, I mean, that's something that has to be retrofitted into buildings, right? And like while that is going on, like even if you already have a fairly effective ventilation system, but you just need to kind of replace all of the filters on there to use the most effective kind and so on. While that is going on, is there no room, do you think, for those precise 22-hour curfews and so on, to keep people safe while the built environment isn't yet equipped to clean things as much as it can?
Oh yeah, like if we have bird flu spreading, which kills half the people it infects, we'll have to do something. Otherwise, we'll it'll be like Thanos. It'll be a Thanos moment for humanity, right? So,
Yeah,
we'll
Black Death Redux.
pretty much. So let's hope that never happens. But it would be better if we did it proactively now. Like my children, I go to a private school where they have 4 giant HEPA filters in each classroom, and they are almost never
That's a big
sick.
number.
Never sick, like once a year maybe.
That's pretty
And
amazing. Like for their ages, like yeah, that's the
and they send
kind of
any.
age group where everyone's like always getting sick, right?
It's crazy. Like
So
they send any kid with symptoms home immediately.
mm,
That's the other thing.
right.
So they control the symptoms, and then they have great air quality, and yeah, they get sick maybe once, and then I have friends who are constantly every 3 weeks they're sick with something, because their schools are probably what we call sick buildings. Like they
Mm,
keep and don't circulate the air. The CO2 is probably off the charts, and they're constantly passing viruses back and forth.
right. Now, to kind of to go back to the topic of vaccines, but not COVID vaccines, but rather vaccines in general, because you see, like every once in a while, I hear anti-vaxxer opinions, and then I worry about not only about the people with those opinions, and and sort of the effect that it might have, for example, on their young children if they have young children and so on. But I worry about society in general, because that seems to be a kind of view that's spreading, or at least was spreading for a while. And an example that I gave you a few days ago, and that I can give again for the benefit of our audience is with chickenpox. So I have a friend, who thinks that when a child is infected with chickenpox, that's completely harmless, and so the only reason why um, government health bodies would be pushing chickenpox vaccines onto parents, for their children, is because the WHO is pushing this narrative that people ought to take vaccines, and so what they're engaged in is a propaganda of fear, and that they're working in the interests of vaccine manufacturers. Now, if it were one person, who thought this way, that's one thing, but I think that there's a section in society and in Western societies in general who are starting to think in these sorts of ways. So then I guess the question is, um, well, and if they thought, if the people who think this way thought that the vaccine is just like a placebo and it doesn't do any good or harm, then they probably wouldn't be so opposed to it. But rather, the thing is that they talk about like lead in the vaccine and all kinds of harm that the vaccines can supposedly cause. So then, my question to you then is, if we compare any potential harm, and I mean, to be fair, one of the last times that I got a vaccine, so long before the COVID era, it was for something else entirely. I was about 21, and I was warned that there's a 1 in a million by the nurse in the U.S. that there's a 1 in a million chance that I would actually die from that vaccine. Now, so in general, if we look at vaccines against these sort of everyday illnesses such as chickenpox, um, if we measure the risks versus the benefits, what can we say about the difference between the two?
So chickenpox, your friend is not completely wrong. Like for most, it's a fairly, it does cause the itchy rash and that infectious period. When it was developed, it was, in wide use about 20 years ago. It was sold as a way to, it's widely used in North America, but I think the UK, they don't give it because it was widely used as a way so that parents don't have to take their, go miss work because their kids are sick.
Right.
So that's one way. So it doesn't stop mostly life-threatening illness in children. So that's more of a discretionary one. The thing is with, some unlucky people with chickenpox develop what's called encephalitis. So that's inflammation of the brain, which is, very often deadly. So it's very rare, but it happens. Less clear-cut is measles, which, kills and disables, before the vaccine era, millions of children, and still does in the large parts of the developing world. So, chickenpox is a bit of a discretionary case. It causes a lot of pain and annoyance to those who suffer from it, but doesn't kill, except in rare cases. And it isn't even mandatory in some developed countries. But measles is a whole different kettle of fish. Smallpox, it's eradicated now, but that killed 1/3 of the people it infected. Polio, which it disables. It shows up as stomach flu for most people, but it disables 0.5% of everyone that it infects. And we saw Franklin Roosevelt. He was in a wheelchair half of his life because of it. So I think the fact is, like, why these kinds of ideas are spreading is that we are maybe one or two generations removed from the generations that were badly hit.
So we're the victims of our own success, in a sense, right, as a society?
Exactly. Like if you went back in time and met the people, if you read the articles of what people there or talk to people who lived in that era, when the polio vaccine came out, there was such excitement. The crippler was defeated. They wouldn't fear for their children becoming, cripples from a virus like that. That was the great fear. Their children wouldn't be in an iron lung for their whole lives, because it wouldn't paralyze their lungs and their diaphragm, and you wouldn't need machines to breathe for them for the rest of their lives. So, that we're too far removed from that. We're 40, 50 years from that. My own grandmother on my mother's side died of tetanus, a vaccine preventable illness. That vaccine was available when she died, but it never reached her part of the world when she developed it. So, I'm only one degree removed from one generation removed, but many people in this part of the world are 2 or 3 generations removed from losing relatives to that kind of thing. So
long enough for memories to have faded.
Exactly. Your grandparents aren't around to tell you how terrifying that time was.
Mm. Right. That makes sense. Um, Now, switching topics sort of entirely, um, I remember us talking in Montreal about the diseases that you sort of personally observed, disproportionately among the South Asian community here in Canada. Could you, given that we're both of that background, and perhaps some of our audience will be as well, and in fact, the largest the largest number of viewers of this podcast are located in India, as it happens. That's not
Oh,
something I
really?
was expecting when I first launched it. So yes, what sorts of diseases affect South Asians to different extents from the general population in North America? And then why do you think that difference exists? Like, what is it about South Asians that makes them attract those particular illnesses?
We definitely have much higher diseases rates of what we call the metabolic syndrome. It's a combination of high cholesterol, diabetes, and heart disease. So these three kind of work together to ruin your arteries, fill them with cholesterol, constrict them, and then give you heart attacks early in life or
So
strokes.
is it just like high volumes of meat consumption that cause that, or what?
I think, there's a variety of causes. Could be diet. Our, South Asian diets tend to be very oily, a lot of saturated fats. It could just be genetics as well. Maybe, founder populations in South Asia were more prone to this kind of thing. The other thing is with South Asian populations, obesity hits harder. So 10% excess body weight on a South Asian is like 30-40% for other people's. So
In what sense?
it's just like the impact. So if you have an extra 10% of body fat, you will develop all the ill effects of someone much heavier than you if you're South Asian. That just seems to be the case. And I
That's
don't know
very
what it
interesting.
is. The other thing is, exercise culture really isn't really, we see the dismal, of our countries, how they do in our ancestral countries, how they do in the Olympics. Like athleticism is an exercise. They're completely alien concepts to especially the older generations.
I mean, I think there's a reason why cricket is, by far the most popular sport in most of South Asia, and that is that it's a sport that you can play at an international level without having to run much most of the time. You can just kind of, stand and watch for the ball. So yeah,
It's
that goes with that.
interesting. I see my American cousins and relatives who, America is much ranks athletics on a much higher pedestal, almost the same as academics
Sure. Yeah.
in South Asian culture. And, they do very well. Like, I think the genetics are there to do really well in athletic activity. It's just, it's not the
The willingness
cultural
isn't there, right?
willingness isn't there. And I think that's something that can be developed over time. So I think that would really mitigate a lot of the damage, hopefully.
Hmm. Right. And so, yeah, I mean, this has been very enlightening. So, thanks again. Now, probably the final question for the night, and it's a kind of broad one, is what do you think, looking into the future? We've already discussed the risk of a coming future pandemic, whether it's the bird flu or something else. But what do you think would be the biggest concern in public health here in this country and then in the world at large?
Yeah, like we discussed, a respiratory pandemic, the ongoing toll of COVID-19 on, heart disease and acute illness and long-term COVID. That's one concern. I think, yeah, future pandemics, like I mentioned. I think, we're also in a coming age of synthetic biology. Like the tools to create pathogens is becoming, are more and more available to regular civilians. So, there are some theories that COVID-19 itself was created in a lab using, experiments that went awry, unfortunately.
Have those been disproven, or is it just that on the balance of probabilities we can say that it probably was natural, right? Is that sort of the conclusion we've come
Very,
to?
it's very controversial. I don't think there's any solid consensus on it. I think the virologists are keen to see that it's a natural accident, like from a market versus their critics say that why were you doing research trying to make viruses more potent in the first place? These are called
Mm.
gain of function research. Why were you trying to make worse viruses to study them?
Sorry, what function did you say?
It's called gain of function research. It's to
Gain
give
of
a
function.
virus,
Okay, right, yeah.
give a virus more functions to be harmful, so that
Right.
to see what it would do. There was a research proposal to create a virus similar to COVID that was declined in the US side, but there's a theory that maybe the Chinese lab went ahead and did it. But it's very controversial. You know, I'm not completely well read on the subject, but there's a lot of smart people on both sides who can, you know, who have compelling evidence. I don't think we'll really ever know.
Right.
But I think overall the tools to do this kind of work are getting more widespread. So that's something we have to prepare for as well. A bad actor, you know, trying to recreate something like smallpox or something like that. So
I mean, that would
like
just
I said,
wreak havoc on society, right? I mean, is there a way that any society can forestall that sort of thing, or prepare in any meaningful way, or are we just completely vulnerable?
I'm going to sound like a broken record, but you know, the ventilation and the
Sure.
mask.
Yeah.
So
Fair point.
you disease-proof our indoor spaces. Bad actor, that whatever they do will fizzle out because our wastewater will pick up something strange. We know where it happens, and then we can just say, okay, everyone in Kansas City put on a mask for 2 weeks, and whatever it is, die up. We should be able to do that in the future, but we probably won't.
Sure. All right. Well, thanks so much, Kashif. Thank you for giving us your time, for joining us tonight from downtown Toronto. And good luck with all the work that you do, you know, to keep us safe and well ventilated. And
Thank you.
I'm sure you've given our audience a lot of interesting things to think about. So thank you once again, bahut shukriya. And we'll see you later.
Well, thank you so much for the opportunity to speak to your audience, Rashid.
Thank you. So thank you for tuning in to this conversation with Dr. Kashif Pirzada. And if you found it informative, which I hope you did, please feel free to check out our previous episodes, and also, of course, stay tuned for our future episodes with new guests. Also, if you would like to support this work on Patreon, feel free to do so. And if you'd like to buy me a coffee, you can do so on Buy Me a Coffee. Thank you, and hopefully I will see you soon. Bye.